Yes, all right, ladies and gentlemen, lovely to see you again. Connor Rhodes from Slum Society. Today we're going to be looking at this article, which I'm bringing this up from the BBC, but this is all over a variety of different news publications at the minute. New guidelines have come out about waist to height ratio, how wide or large or not, I guess, the circumference of your waist is versus your height and what this can mean for your health. So let's talk about this. Let's discuss this and go through it. Leave on comments and questions about what you think. Let's jump straight into it. Keep your waist to less than half of your height, guidelines say. This is by Philippa Roxby. Thanks. And a nice photo of a guy's waistline with a tape measure. I'll zoom in a little bit here so you can see what's going on a little bit better. An adult's waist should be less than half of their height in order to reduce health risks, guidance says. People should be encouraged to measure their waist to check they don't have too much dangerous fat around their middle. Updated guidelines say. Who do these guidelines come from? They are NICE recommendations. Who are NICE? That's these guys, National Institute for Health and Care Excellence, which NICE in and of themselves are quite excellent in my opinion. I like them. I use quite a lot of their guidelines and advice myself. Measuring body mass index is also useful, but doesn't take into account excess weight around the abdomen, which is it's kind of a fair point. BMI is a decent tool. It's not supposed to be used on you, but it's a populational average tool. We know how it works. It's this old doozy that we all love to hate, doesn't it? The BMI, but it's not bad as a populational average tool. But it's kind of right. It doesn't differentiate between just body fat overall and abdominal obesity, when abdominal obesity, to be fair, over time has been shown to be a correlating factor with poorer health outcomes. So the abdominal obesity is a little bit more important to pay attention to. I've actually got a study here to show you. It says waist to height ratio as an indicator of early health risk is simpler and more predictive than a matrix, meaning a sort of congruation of factors based on BMI and waist circumference. So we have got studies showing that this is a correct tool. Essentially, look, I've got another one here. Waist to height ratio is more predictive of years of life lost than just body mass index alone. So the BBC is saying this increases the risk of conditions such as type 2 diabetes, high blood pressure, heart disease and stroke. They're talking about abdominal obesity there, and that's true. New draft guidelines from the National Institute of Health and Care Excellence, NICE, says people from some Asian and black ethnic groups are more prone to this type of fat buildup around the waist, and this is called central adiposity. Adiposity. That means fatness. Essentially, adiposity. Doesn't it? And maybe there is ethnic factors on this. There are differences, or there have been shown differences in some ethnic backgrounds with insulin resistance and stuff like this, so maybe that's true. They should use lower BMI thresholds for obesity to help predict their specific health risks. That's interesting, isn't it? That's interesting. But NICE warns that even those in a healthy BMI weight category could be carrying too much weight around their waist. That can be true. Just because you're in a certain BMI category, it's an average tool, the BMI. It doesn't mean you are this BMI, therefore your health is like this. That is not what it means at all. They explain to people that to measure their waist, they should find the bottom of their ribs and the top of their hips. Wrap a tape measure around the waist midway between these points. Breathe out naturally, so no sucking it in, ladies and gents, naturally before taking the weight measurement. Says guidelines on identifying people who are overweight and are obese. Measuring waist to height ratio can be used for both sexes and all ethnic groups as well as muscular adults, it adds. That's true, to be fair. That's a decent point, isn't it? Because it doesn't matter how muscular you get. You can't really jack out your waist too much. Like, it doesn't matter how many side bendies you do or twisties or crunches. You're not really going to thicken out the waist too much. It's not really a massive area of muscle growth. So the wider the waist is, apart from genetic bone structure, which so I feel like some ladies could fall prey to this, because some ladies have, and they find it, sometimes people find it preferable, don't they? Like a small waist and then wider hips, going for that nice hourglass figure. A lot of people like it. I feel like some ladies, due to wider hip structure and maybe just that hourglass figure, could fall a little bit prey to this. But again, when we're talking about things like this, we're only talking about averages. It's not supposed to be pointed out to every single person as the exact be all end all, this is the only thing that matters sort of tool. That's not the way that it works, but waist circumference measurements are not accurate in people with a BMI over 35, pregnant women or children under 2. What is a healthy body mass index? We'll not go into that right now. I'm sure you know how to use a BMI chart. If not, message me, I can help you with your BMI if you want, but it's just got height and weight, and then it just tells you roughly what category you're in. Again, it's not to overthink the BMI too much. In this guidance, GPs and nurses are advised to ask someone's permission before talking about their weight. That's nice. That's nice. I'm obviously a health and weight management nutritionist. A lot of my members and people that I coach have been upset by GPs and, let's just say, NHS practitioners in general. I'm in the UK. Some of you listening aren't or won't be, but they're obviously health professionals, but they're not always the best trained in not being so brutal and blunt about it sometimes. I've known a lot of people be upset by the way that they have been approached or spoken to about their weight by NHS professionals, etc. So it's nice to see this guidance because it is a sensitive subject. It literally is a sensitive subject. This is something that many, many people struggle with, isn't it? Their weight. It's something that impacts their physical and mental health, and they know about it, don't they? People know about it. So you just got to go careful with these things because upsetting people just doesn't help, does it? You can't aggravate people into being slimmer. You can't upset somebody slim, can you? So it's just not going to help. But being nice and showing care and compassion, that does help. I can say firsthand, I promise you that does help. Advice on managing weight is usually tailored to the individual and focuses on improving diet and getting them to exercise more in addition to potential treatments and surgery. That's nice. That's the correct order as well. Number 1, diet is the most important factor. Exercise is the second most important factor. And then if you are trying your best to do the diet and exercise, and you have contacted Conor Rhodes from Slim Society and used an actual effective and efficacious and successful weight loss program that is tailored for you, and you're not just joining flipping Slimming World again and being like, this time will be different. If you're actually doing something proper and good about it, of which I have a 50% offer on my program right now. So message me, let's go, let's get it on the go. Ladies and gentlemen, let's get it on the go. If you're trying to diet and exercise and it's not working, then you can see your doctor. And as you probably do know, there are drug-style medical treatments and surgeries, of which I coach people who are using these two. I am not a doctor and I do not control your medication or anything like this, but many of my clients are using doctor support, different drugs, different medications, different pills and potions. I've got clients on the quote-unquote skinny jabs like semaglutide and liraglutide and stuff like this, and I've got clients right now and had all clients who've had all different forms of bariatric surgeries, you know, like gastric bypasses and gastric bands and stuff like this. And these are all tools that you can or may want to use for you there to consider. The latest estimates for England suggest that 28% of adults are obese and a further 36% are overweight. So that's 64%. So that's nearly 2/3 of everybody in the country now is overweight, a problem that is costing the NHS more than £6 billion. Dr. Paul Crisp, spelt with a H, director of the Centre of Guidelines for NICE, said the updated draft guidelines help people to understand what factors affect their health and how to address them. Apparently it's easy to use, says Professor Rachel Batterham, consultant in obesity, diabetes and endocrinology, who is in the guidelines of the committee, said increased fat in the abdomen increases the risk of a person developing several life-limiting diseases, including type 2 diabetes and heart disease. Waist to height ratio is a simple and easy to use measure that identifies people who are at health risk and would benefit from weight management to support their health. I mean, we can't disagree, can we? Oh, and Doctor, I hope I'm not pronouncing this wrong, representing the hometown here for me, representing Sheffield Children's Hospital, of which I have some clients who work there as well. Shout out to the great and powerful ones. Dr. Aswani, let's just go for that. Consultant pediatrician specializing in diabetes and weight management at Sheffield Children's Hospital said even young children were at risk of the effects of fat in the abdomen. Of course. It says with 25% of year 6 children obese by the end of primary school. Wow. Now that's something, isn't it? So last thing then, let's have a little look at this. Let's see. I'm 5'9", so let's start there. Or let's have a look in inches, because we do weight measurement generally in inches, don't we? I know that I'm like a 29-30 on the waist or something like this, so let's see what comes out. I also know that I'm 5'9" in inches. Let's see if I can spell that. Let's see what this turns out to be. Oh, I thought it was giving me 5'6". No, I put 5'9", and it's just immediately denied me and said, no, you're not 5'9", you're 5'7.5". But it's saying 5.5 foot, isn't it? All right. Well, we can only hope, can't we? It's apparently 69 inches. All right, lovely. So it's saying my waist, and in this waist to height ratio, it's saying that if your weight to height ratio is less than half, then that's good. Then that's good. So what's half of 69? That would be 34.5. So I'm in the decent range then, because I'm like a 30. If it's around Christmas, I bump up to like a 32, something like this. So I'm well within the nice range. Nice range is not supposed to be a pun there. National Institute of Flipping. You know, most ladies are not 5'9". What's a height for a lady? 5'4". So you're 64 inches. So you'd be looking at 32 or below. Let's say you're just a straight 5 foot. Let's say you're a little tiny. Then you're on a 60. So then that would be a 30-inch waist. This doesn't sound bad to me, does it? This doesn't sound too bad. It's not. Again, it's not the be all and end all. It's not supposed to be the. It's just not the be all and end all, but it's just one tool to look at. Please let me know what you think to this. Maybe work it out for yourself. If you're not sure how to work it out, send me a little message. What do you think to this weight to height ratio thing? Seems to make sense in terms of the statistics, doesn't it? But how does it make you feel? Also an important factor. Thank you so much, ladies and gentlemen, for checking this out. Let me know what you think. It's all over the news at the minute. Drop on your comments and questions. I'll speak to you and I'll see you again soon.